Hello guys, welcome back to my channel. My name is Opayemi and you're very much welcome. So in today's video I'll be talking about clinical research nurse interview questions in the NHS. So if you haven't seen the video yet, I made a video specifically explaining how I got a band 6 clinical research nurse role despite being a band 5 theatre nurse with zero experience in clinical research. If you haven't watched the video, please go ahead and watch it. So I'll leave a link in the description just so you can watch the video after this, or maybe you go and watch the video and then you come back to this. So today's video will be all about the interview questions that are peculiar to clinical research nurse role. So this is like a compilation of the questions I got in all the interviews I attended for this role, which is the clinical research nurse role. So I've compiled all of the questions. So about 3 of these questions are not like questions I actually got, but I kind of coined them into questions because they were clues I got when I went for informal visit in the clinical research department of my hospital. Anyways, let's just get started. So you guys already know the first question. Honestly, I don't know why they ask this question in every interview. Anyways, the first question on my list today is tell us about yourself. Now before I go ahead, let me just let you guys know that I may be looking down at intervals. That's because I've actually made a note on my iPad. I've made a note of all the questions, so if you see me looking down, that's because I'm pretty much staring at my iPad. So the first question is tell me about yourself. The interviewer would be like, oh, so tell us about yourself, or tell me about yourself. Now I do not have like a specific answer to this question because I know that over the years, like different people or different experts have like different opinion as to how to answer this question. So I'm not an expert in answering this question. All I can say is for all the interviews I've attended, I mean even outside of clinical research nursing, it's always been the same. I pretty much introduce myself like my name is Opayemi, and then I go ahead to talk about my work experience, my qualifications, and then my skills. So it's always in that way, like a summary of, okay, so my name, my work experience, the specialties I've worked in the past, the capacity in which I've worked in the past, and then I go on to talk about my qualifications, like I have this qualification, I have that qualification, and then in summary I just talk about a few of my skills. So it's usually like a summary of like all my achievements, so to say, more like a personal statement, but a summary of that, if you guys get what I mean. But I'm not an expert in this, but this is always how I've answered this question like over the years. So you may want to come up with your own, but that's pretty much how I answer this question. Even if I get asked the same question tomorrow, this is like a fixed template for me. I start with my name and then my work experience, my qualification or my qualifications, and then few of my skills. So it's usually like a summary. I don't go too far because you will still have like a lot of time to talk about like your skills and all of that in details. So the next question they asked me was, why clinical research? So they pretty much wanted to know why I wanted to switch, given the fact that I was coming from theatre. So why clinical research? So if you're answering this question, just let them know why you're passionate about clinical research nursing, and when you're actually describing or explaining why you want to switch into clinical research nursing, let them see that passion in your eyes, in your gestures, how you articulate yourself, your facial expression. I mean, let it also show even in your non-verbal expression, if that makes sense. So don't just say it with your words, show that you're truly passionate about this role or this specialty or this field in nursing. So let them also see it in the way you talk, in the way you express yourself, your gestures and all of that. So pretty much just explain why you're passionate about clinical research nursing. I think that's what that question means, like why clinical research, like why not ICU, why not community nursing, why not district nursing. Like they want to know why you have chosen clinical research nursing in this situation. So the third question I put down is, okay, so what skills or qualities do you have that will make you stand out as a clinical research nurse? Now for this particular question, I really could not remember how they actually put it, so I'm paraphrasing here, but I remember it was all about this. They were asking me to tell them why they should choose me, like why should we choose you out of like tens of candidates. Why are you going to be the best candidate? Why would you stand out? Like what skills, what qualities do you have that will make you stand out as a clinical research nurse? So I feel like for this you really need to do a lot of research, right, as regards the roles of clinical research nurses. So in this situation, tell them about, you know, time management. As a clinical research nurse, you have to be on point and you have to be on top of your game when it comes to time management, because you're handling your portfolio. You have to have like organizational skills, leadership skills, of course. You have to be able to delegate tasks. You should be able to work in a team, and of course work, you know, autonomously as well. So, you know, go ahead and read about the roles of a clinical research nurse, and that's pretty much what you need to reiterate when asked this question, like what skills or what do you have that will make you stand out as a clinical research nurse. So the next question is, can you share an experience where you had to resolve a conflict or disagreement amongst team members? So pretty much, I feel like, in my own opinion, this is pretty much about conflict resolution. They want to know how you'll be able to manage crisis, you know, in your team. For instance, if a conflict arises or a disagreement arises, how you'll be able to manage that and resolve it, and you know, de-escalate the situation. I feel like it's more about how you would actually de-escalate a conflict whenever it arises in your team, whether you are just a team member or you are even like the team lead. So explain how you've done this in the past. During the interview, they actually told me they know that I don't have any experience in research nursing. So for all of these questions, I could take it back to my days in theaters, and that really made it very, very easy for me, because for all these questions, I just took it back to my days in theaters or my experience as a theater nurse. So yeah, just explain to them how you have resolved you know, a conflict in the past. Can you explain the process of obtaining informed consent from your patient? So I feel like, despite the fact that in clinical research nursing, informed consent is like very, very key, so it is in other specialties, right? Like informed consent is like very, very crucial. So don't get scared when they ask you you know, the process of obtaining informed consent. Trust me, it is pretty much the same as you do maybe on the wards, in theaters, in ITU, in the community. Just explain the whole process of informed consent, what makes a consent valid, how you shouldn't force the patient to get consent, how the patient should have full knowledge of whatever procedure now in court that you'll be doing, and don't forget the mental capacity as well. So these are things you already know. Everything you know about informed consent, talk about those things. That's what you want to hear. You want to hear about the mental capacity of the patient. Is the patient of consenting age, for instance? Is the patient fully aware of what they are consenting for? Do they understand? I mean, all those things. Validity of the consent as well. Is the consent properly signed and dated? And all of that. So yes, that's what that is all about. Don't get scared. Okay, so they also gave me a couple of scenarios in my interview, and one of them I would actually share now. So they said, now I'm paraphrasing, like I can't remember how they said it exactly, but I'm just paraphrasing. So they said, what do you do like if a doctor already consented a patient like earlier, and when you were about maybe carrying out the procedure or whatever it is, you realize that the patient doesn't have like enough knowledge, or the patient doesn't fully understand like what the procedure is all about. Now I'm saying procedure, for you it could be anything really as a nurse, but let's just choose procedure. So maybe during your own assessment of the patient, you realize that the patient cannot fully comprehend what has been explained to him earlier or to her earlier, and I mean, from your own intuition as a nurse, or let me just say from your own assessment as a nurse, you realize that this patient has not been properly consented. So what do you do in that situation? So it's still the same thing you would do as a nurse. Like coming from theaters, for instance, I already know that if I have a feeling that this patient does not fully understand the consent he or she has signed, you call the attention of the doctors. I mean, as a nurse, you have that power to call the attention. If it means re-explaining to the patient, going through the same information again and again with this patient, just to ensure that truly they understand what this is all about. So talk about what you would normally do, maybe on your ward, in your present specialty, what you normally do as regards informed consent. So they also asked me, what do you do if a patient decides to opt out of a clinical trial? So it may not be a trial now. For instance, I think they were even like, okay, like surgery, for instance, patient is already in theaters. What would you do if a patient all of a sudden, like before administration of anesthesia, for instance, and the patient says, you know what, I don't want to go ahead with this surgery? What would you do? So for this question, answer it the same way you would, the same way you would do on the words wherever you work. The same. I feel like these things are pretty much the same. If a patient says no, their no means no. So it's the same. Like, what do you do if a patient opts out, of a clinical trial? You grant their request. You don't force them. You don't coerce them. You may wish to explain the procedure to them again, but if they continue to say no, their no actually means no. So that's what that is all about. The next question: what strategies do you use to effectively communicate complex medical information to patients? So I know this is very, very crucial in clinical research nursing, because I know they always give the patient like a patient information sheet, and then the patient can actually go home with that, read it, so they understand what the clinical trial is all about. But don't get bothered about that. Even in your present field, how do you explain complex information to your patient? That's what they want to hear. That's what the interviewers want you to explain to them, like the medical jargons, or say the patient is coming into theaters for a knee replacement. How do you break it down in such a way that the patient will understand what the procedure is all about? So that's what they want you to tell them, how you would effectively communicate complex, or ambiguous information to your patient. Okay, so the next question says, tell us a time a colleague pointed out a weakness to you and how did you deal with it? So this particular question is very tricky, and for me, whenever they ask me about my weaknesses, my strengths, generally in interviews, it doesn't even have to be like in clinical research. Like over the years, whenever an interviewer like says, oh, tell me about your weaknesses and your strengths and all of that, I don't fall for it. So I give them a weakness or weaknesses that, truth be told, they're like strength. So to say, in the past I've talked about the fact that I'm a perfectionist and I want things to be done like in a certain way. I want things to be done, to perfection. That's like a weakness, but it is a strength. As a theatre nurse, I've talked in the past in certain interviews, I've mentioned the fact that I have a certain level of OCD because I'm very cautious of sterility and people trespassing or people getting close to my sterile field. Even though OCD is like a form of sickness or illness anyways, but it just shows that you're very, very, very committed to ensuring that your patients won't come down with an infection post-operatively. But so it's a weakness, but it's a strength, but I make it look like a weakness, or maybe vice versa, I don't know. So in this situation, the weakness I actually talked about was about delegation, which is also a weakness, so to say, but it is a strength. How I don't like delegating tasks to people, because I like doing things myself just so I can ensure that the things are done perfectly. However, we all know that delegation is key as a nurse, and you can't do without delegation. If you want to perform optimally, you need to delegate certain tasks. But that was the answer I gave for that question. Okay, I think I might just run through these questions because I've got about 23 questions and I don't want this video to be too long. Okay, so next question, can you describe your experience in conducting and managing workloads? This is also applicable to whatever field you're presently working. For me, as a theatre nurse, I pretty much just explained how I manage operating lists for the day. So I actually just explained how we manage each list for each theatre, because there are several operating rooms in a theatre, right? So I pretty much just explained how we manage our operating list for each day, or operation list for each day. So it may be on your wards, how you guys manage the workload, or how you guys manage patient allocation for the day. I don't know how it works on the ward, but wherever you work, I'm sure you have your own workload or caseload or portfolio or task, job allocation, whatever it is. How do you manage it? How do you manage our workload for each day? So that is what that question is all about. How do you prioritize and manage your task when overseeing multiple trials? Okay, so now I'm putting trials, but like I said during my interview, they already told me that you can take it back to your days as a theatre nurse. So even though you have no experience as regards clinical trials, so just so you're very comfortable, talk about the things you already know, so theatre nursing, surgeries, operations and all of that. So how do you prioritize and manage your tasks? It's still the same thing as regards prioritization. Delegation is also very, very key, doing the most important things first. However you manage your task, tell them about it and how you prioritize your task on a daily basis at work. Mention it and talk about that. Okay, so next one, what steps do you take to ensure accurate data collection and documentation? So this is also like, this is very key in nursing: record keeping, documentation. If it's not documented, it wasn't done. Or how do we say it? If it's not documented, it's not done. Or if it wasn't recorded, it was never done, something in that line. So whatever is not written down or documented, maybe on the computer, on the software, it just means that it was never done. So we'll talk about the importance of record keeping and documentation. So even though you have no experience, for instance, in clinical research nursing, wherever you're working at the moment, you collect data, you document, you keep records. Tell them how you ensure that those records are up to date and they are accurate and all of that. Okay, I remember this next question because it was a very, very tricky one. So they actually asked me so they said, what do you do to manage an aggressive patient? Guys, it was a very, very tricky question for me, and honestly, I remember I talked about a pediatric patient, and they said, well, it's not like the patient, I mean, that was a response at first, like, it's not like the patient was aggressive, the patient was just restless. Children can be restless. So they were like, give me another scenario of how you manage like a very, very aggressive patient. So you may want to think about how you've handled aggressive patients in the past. And I think the emphasis, in my own opinion, the emphasis now looking back, I think they wanted me to talk more about how I would de-escalate the aggression, like when you're faced with an aggressive patient, what to do, the distance you maintain between the patients, especially if you can foresee violence, how you de-escalate the situation and ensure that no one is hurt, how you reassure the patient and all of that. But of course, go read up about that. How do you manage an aggressive patient? Next question, describe a situation where you had to address a communication challenge within a multidisciplinary team. So for this particular question, I remember so one of the interviewers said, okay, for instance, you feel what is best, like you know what is best for this patient in theaters. For instance, patient is in theaters in the operating room already for a procedure, and the surgeon insists on doing it a particular way. Like, how do you undo like that kind of difference in opinion and all of that? So I pretty much like told them what I've done in the past in this situation, because I mean, if you've worked in a team, you understand that there are times that like one or two of you would never be on the same page, you know, about management of that patient. Like, even though you all are looking towards achieving the same goal, which is patient safety, recovery and all of that, but the way you want to go about it can be different. So I pretty much just explained how I handled that in the past and ensured that everybody felt, you know, happy at the end of the day, like no one felt bad, no feelings were hurt and all of that. Next question, so how do you stay updated with latest regulations and guidelines? So like I said, even though this is about clinical research nursing, take it back to wherever you work at the moment. How do you stay updated with latest regulations? You do mandatory trainings. You yourself, maybe you even register for, you know, courses, paid courses by yourself. I know some people do. I do as well. Besides the mandatory training that they provide at work, there are times I register for trainings myself outside of work and I pay for those trainings. I read articles and journals as well. I mean, whichever way, you know how best you update your knowledge on a regular basis. So talk about that. Okay, so I remember another question which is about change management, and I must also say that one of the things that actually helped me in all these interviews, I would say that is because of the fact that I'm presently doing a postgraduate degree in nursing, like a master's degree in nursing, and one of my courses is actually change management, project management, strategic management and all of that. So these kind of questions are kind of very easy for me to answer, I mean, because I know a lot about them. So this next question is about change. So they put it like this. I think this is the way they put it to me. Can you provide an example of a time when you had to adapt to a change, and how did you handle the change? I'm trying to remember how I actually answered the question, but I pretty much just told them that change is inevitable and change is necessary for, you know, progression, for development and for growth. So I mean, change is mandatory if you want to grow, and that mindset actually helped me to adapt quickly, knowing that change was like very, very essential for growth. And then I also talked about a few other things on how I was able to, you know, adopt a new change in maybe the way we used to do things, and how we're able to, you know, move on and handle that situation. Okay, so in a fast-paced environment, how do you ensure attention to detail and accuracy in your work? Guys, nothing is very tedious. We're always like on the move, and there are times that we miss certain details because of the pace, especially if you work in a fast-paced environment. So they want you to tell them how you ensure attention to detail and that you don't miss out on information. Do you get like information does not get lost, you know, despite the fast pace? So describe that to them, explain how you've done that in the past. If it means taking note, like for me personally, I don't just commit things to my memory, I actually put things down. So don't just assume, oh, I'll remember to chart that patient's vital signs, for instance. I'll remember to give that patient medication. You should probably have a note that you take to work every day where you actually write things down. So at the end of your shift, you can look at the things that you've done, things you've not done, things to hand over, and all of that. So your own way, I wouldn't know how you do that, but your own way, just explain how you ensure that you pay attention to details. Next is about privacy and confidentiality. So they said, how do you maintain confidentiality and patient privacy? Like I said, even though this is about clinical research nursing, as a nurse, you know how to maintain confidentiality and privacy, how to ensure patient information does not leak. So if it means talking about Caldicott, let them know you know so much about Caldicott. I mean, you already know how to maintain patient's privacy, so talk about that. So now, before I go to the clinical scenario, so for all the interviews, I got at least one clinical scenario. But before I go into that, there was a question, not a question. So they actually told me to present a patient information sheet to a patient as though it was real. Do you get like? So one of the interviewers was a pretend patient, and I was asked to present a patient information sheet to the patient. So a patient information sheet is like a document that explains in details what the clinical trial the patient is about to participate in, what the clinical trial is all about. But you don't just hand over the document to the patient, you also give like an overview or a summary of what is in that document. So in one of those interviews, I was asked to now present it to a patient as though it was a real patient, but of course it was a pretend patient. So I had to do that. Like I was given the document like maybe a week or 2 weeks before the interview anyways, so I had enough time to prepare and commit everything to my memory. So now let's go to the clinical scenarios. So for those interviews, I got to like one scenario per interview. So one was about sepsis. So it's not like they will tell you sepsis. They pretty much told me the patient's symptoms or the presenting signs. So the signs that the patient presented or what the patient mentioned to them. So I remember for the one for sepsis, so they said something like so a patient comes in for a clinic, a clinic visit, and then you take the patient's observations, and then the pulse was this, blood pressure was this, temperature was this, respiration was this, pulse was this. What would you do? And so I'm just saying sepsis now because the information they gave me, or the vital signs and results that they gave me appeared to be that of a patient with sepsis. So I mean, so you as a nurse, because you already have experience in nursing, so when you kind of look at a set of observation, you can actually tell like the diagnosis, even though it's not confirmed, but the potential, let me put it like that, the potential diagnosis. So as soon as they gave me, the set of observations, I just knew that it was sepsis. So I kind of told them, I have a feeling like with what you've presented to me that this patient might be tending towards coming down with sepsis, or maybe already even has sepsis ongoing. So then for instance, so for sepsis, don't forget, you tell them why you think it's sepsis. Like in this situation, oxygen saturation had dropped, patient already had tachycardia, like the pulse was up, respiration was up, temperature was up, so patient was already hypothermic as well, and I think blood pressure was down. So with all the information, I could actually tell that, okay, it looks like sepsis to me, whatever. Oh yeah, the patient had fever. I think I mentioned that, yeah, the temperature was up as well. So, and then I went on to now talk about how you manage sepsis, especially because this is the NHS, so you stick with the NHS protocol of managing sepsis. And I think in the NHS we use this, there's a bundle we call, I think, sepsis 6. You might check that up online. I think that's a bundle we use in the NHS to manage sepsis, which includes, I think, oxygen. You give the patient oxygen, antibiotics, fluids, urine output monitoring, lactate measurement as well. So it's about 6 of them, like the standard management of sepsis. So go through all of that. And yeah, so that was what I said. The second one was about AKI, which is acute kidney injury. Like I said earlier, they also gave me like the presenting symptoms, like a set of observations from the patient, like it was a patient came into, also I think for the AKI they pretty much said, okay, a patient rang, like one of the patients on clinical trials actually rang and said, oh, I've got this, I've got that, what comes to mind and how would you manage that situation? So in that situation, you tell them the patient will have to come into the hospital, most likely we need an hospital admission, we take blood samples, definitely take blood samples, and yeah, so that you can measure, you know, the kidney functions, liver functions, and you know, some other stuff, right? So that was pretty much all I said. And but I was very very vocal about the fact that I strongly felt the patient was tending towards, you know, acute kidney injury. So I think they said the patient already had the patient presented with nausea and vomiting, reduced urine output, abdominal pains, I mean a few other symptoms, but they were pointing towards AKI. And as soon as I mentioned AKI, I can remember I saw the lady, one of the interviewers, putting down a note and then ticking it. So it was more like they were waiting for me to mention AKI, like acute kidney injury. So be very specific. If you think it's a particular, you know, condition, mention that condition, because you may be right, and then say how you will now manage the condition. I must also say, when you're talking about sepsis, don't forget collection of blood for blood culture. I think that is one of the key management of sepsis. This sepsis 6 bundle, I forgot to mention culture. So it's you give patient oxygen, blood for culture, lactate measurement, fluids, urine output monitoring, and all of that. So yeah, I think I've come to, you know, the end of these questions. Now the last part of the interview, I mean, for me, they actually asked me, and I think that's the way it is for all interviews, right? They will ask you, like, do you have any questions for us? Have you got any clarifications? Do you have any questions you want to ask? So it was the same, and I had written down 3 questions I wanted to ask them. So for all the interviews, I just kept on repeating the same question. So I'll just say it out loud. You may want to, you know, ask some other questions, but these questions were quite personal to me because I was genuinely interested in knowing the answers to these questions. So one of them was, how did you recruit patients during COVID-19 pandemic? Guys, like, I'm going into clinical research, right? I was just curious, like, during the pandemic, considering that first of all, their patients are already vulnerable patients. These patients already had cancer. So how were you able to recruit them, knowing that everybody was staying at home and people were very scared of coming out? So how were you able to still recruit patients during the pandemic? I also asked them the work culture, you know, in the department, the culture of the department and all of that. And the last thing I asked them was, what do you like most about your job? And I was honestly just curious. I wanted to know which parts of clinical research nursing they found very interesting. And a lot of them talked about the flexibility, how they can find a balance between clinical and non-clinical, you know, settings and all of that. So I think I've come to the end of this video. If there are other questions, like if I get to remember other questions, I may just, you know, put them in another video because this video is actually getting too long. But if you've enjoyed watching, please share this video with your friends and your colleagues that may be interested in going into clinical research nursing. If you have other questions, please put them in the comment section, and of course I'll make other videos just to answer those questions in subsequent videos. And I'll see you in my next video. Bye.